Hi guys, Dr. Carroll here at Movement Orthopedics. I'm going to talk to you a little bit about hip replacement. The way I like to do hip replacement is through the anterior approach, and it's a good option. It's newer, it requires some special equipment. The advantage of the anterior hip replacement is that we don't cut any muscle or tendon. We sort of go in between the muscle. I'll kind of explain how we do that here with this model. So I'll take the plastic piece off here. That represents your skin. And typically for the anterior approach, we're going through the front of your hip here rather than the side or the back, which is the normal way to do it in the past. The anterior hip replacement kind of looks like this. We separate muscle just like this without removing it. We get access to the hip joint through the front of the hip without cutting anything. At the surgical suite, we'll take out your old ball and socket and we'll put the new ball and socket in, just like this. And then there's your new hip. That's done without sacrificing any muscle or tendons. Works great. Less rehab, less bleeding, less pain. Any questions about that, feel free to call or come and see me. We can talk about it. It's one of my favorite subjects.